We're seeing the issue of race, allegations of racism penetrate just about every aspect of American life. In some ways, this all seems so strange because we are now, well, we're 70 years away from the beginnings of the civil rights movement, from the Brown versus Board of Education decision. We're 60 years away from the Civil Rights Act of 1964, and still, we're talking about this. In fact, we're talking about it more than ever. Now, Dr. Fauci was recently speaking at a graduation ceremony at Emory University, and he echoed what is now becoming kind of a familiar line. He talked about the undeniable effects of racism in healthcare. Listen.
That some people of color find themselves in from birth regarding the availability of an adequate diet, access to health care, and the undeniable effects of racism in our society. Let us promise ourselves that our corporate memory of this tragic reality, that an infectious disease disparately hospitalizes and kills people of color, does not fade after we return to some form of normality.
So here we get the woke perspective on healthcare. The idea that, and as far as I can see, when I hear these kinds of allegations, I'm always looking for where is the evidence. What are you actually saying, Dr. Fauci? Now, notice Fauci, by the way, is echoing what other people have said. Here we see the CDC director says racism is, quote, a serious public health threat. And I think to myself, is he saying that hospitals are more reluctant to admit black patients because they're black? That's what racism means. Racism is a kind of theory of inferiority, and discrimination is the kind of practice that flows from the theory. But it looks like these people are talking a different kind of language. Let's listen to this. This is the AMA president, Susan Bailey, who appears to be singing out of the same hymn book. As the COVID-19 pandemic continues to disproportionately plague Black and brown communities, it's clear that collective action from all stakeholders is needed to dismantle systemic racism and confront, embed, and advance equity across our healthcare system. So, I want to translate. What she seems to be saying is that more Blacks and Latinos get COVID than whites. So that's what she means by disproportionate impact. That when you look at their ratios in the population, there are more of them getting it, and maybe more of them dying from it than the whites. Now, if I were to consider the question of is there racism in healthcare, I would start by asking, first of all, how does this disease kind of play out? Are you more likely to get it, for example, if you're poor? Are you more likely to get it if you're fat? Are you more likely to get it if you have certain types of pre-existing conditions? Are you more likely to get it if you live, for example, in concentrated living conditions where you're more exposed to people around you? For example, are urban people more likely to get it than rural people who are perhaps more dispersed? Are you more likely to be severely affected by it if you are older? And all of these are germane questions, and we know answers to most of those questions. And yet, when we hear these doctrines of racism pronounced, I ask myself, did you correct for socioeconomic status? Is it the case that this is not a discrepancy affecting Blacks, but a discrepancy affecting poor people? Because poor people, arguably, have less easy access or have less means to take advantage of healthcare that's available than people who are better off. So is this a socioeconomic problem? I don't see Fauci presented absolutely no data that's teased out these different sorts of variables. What about rates of obesity? Now, Fauci mentioned that, but he mentioned that sort of as if this was like a side point, but it's not a side point. Why? Because while Americans in general are obese, the fact of the matter is nearly 40% of African Americans are obese. They are the most obese population of any ethnic group. Latinos second. They're in the high 30s. And whites are in the high 20s. So the obesity stretches across the society, but it doesn't stretch across differentially. Now, you could say, well, of course, it could be the residual effects of racism that make people obese. And you can go ahead and make that case. But again, what strikes me as so notable is that no one makes these cases. There is simply no attempt to prove your point and say, look, once we correct for all these different variables that do affect transmission and do affect who gets COVID and do affect the likelihood of someone getting a vaccine. I saw one preposterous article that said, we're trying to figure out why communities of color aren't getting the vaccine. Could it be that they're less likely to own an automobile? And I'm thinking, seriously? Is lack of automobile ownership a problem? I mean, people who live in cities, a lot of them don't need automobiles. Is it that difficult to get to a place where you can get a free vaccine? So the bottom line of it is, it seems to me that this allegation of racism, which has not one shred of proof attached to it, not if the doctors aren't racist and the hospitals aren't racist and the medical personnel aren't racist, the simple fact that there's a discrepancy in the number of blacks and whites that get COVID doesn't prove that the system itself, the healthcare system, is racist. So I think what you have here is a kind of generic appeal to history. There was all this bad stuff going on in 1830 and 1920, and then quickly a quick move to the disproportionate impact today. Ergo, there has to be racism. This strikes me as fallacious reasoning, bogus reasoning, but the kind of, quote, reasoning that is sadly all too common today.